Hi, I'm Stephanie Guzman. Today I'm going to be working with Mary So-and-so. She's a 48-year-old female admitted yesterday with abdominal pain and dysuria. She has a history of type 2 diabetes. Her labs came back this morning and she has a positive culture for a UTI. The doctor just gave us some new orders and we're going to be starting her on some antibiotics as well as her normal 8 o'clock medications. So one of the best ways to do effective medication administration is to verify the doctor's orders with the MAR. So we're going to come over to the computer and we're going to verify the orders. We're going to make sure, yes, this is the correct patient. These are all the correct drugs. The metformin, yep, and she needs that because of her type 2 diabetes. Her ceftriaxone, that's her antibiotic for her UTI. And then her insulin, her blood sugar was 180, which is on the sliding glucose scale prescribed for her is 4 units of insulin. So we're going to be doing that. The metformin is PO, the ceftriaxone is IV, and then the insulin is going to be subcutaneous. It is 8 o'clock, so it's time to give that metformin and insulin. She's about to have breakfast. And then I'm going to educate her when we're done, and I will go ahead and document when we're finished as well. So now that I checked, did my first check, we're going to go ahead and go over to the Pyxis station. Now that we're at the Pyxis station, I'm going to go ahead and enter the patient's information. Alright, and it shows for the metformin will be in this drawer. Is this metformin? Yes, it is. 500 milligrams. Yes, that's exactly what we need. Perfect. Now it shows that her insulin will be in this drawer. There are a few medications in here, so we're going to make sure we grab the right one. This is regular and pH. We're looking for the Lispro. I'm going to go ahead and wash my hands again and put on some gloves. We're going to go ahead and clean the top of this for 30 seconds because it's been used by a lot of other people. Improper medication administration, people may not clean this for the full 30 seconds, and that can cause bacteria and potential illnesses to occur for that patient. Alright, so now that we have that, we're going to go ahead and grab the insulin needle. I'm going to go ahead and push in a little bit of air into it. I'm going to push in and pull out 4 units. Perfect. And I can see that. Yep. We use the scoop method. I'm going to go ahead and label that as well and put this back in here. Alright, and the next thing that's showing on this is going to be the antibiotic. And it looks like pharmacy has already mixed it for us. This has the patient's name, the medication, it has the dosages. This matches up to what the doctor has prescribed. It's 2 grams in 100 milliliter fluid. Alright, perfect. So we're going to go ahead and now I'm going to pull everything off to the side. And we're going to make sure this is all correct. So we're going to look at all these medications one more time just to make sure that these are the correct medications. This is going to be the antibiotic. This is the ceftriaxone. This medication is for antibiotics. It is the 100 milliliters, but that has 2 grams in it. We're going to be administering this over, it looks like it's going to be 30 minutes. She's definitely getting this right now because it's a stat order for the infection that she has. And then we have the metformin, which is her diabetic management medication that she has, 500 milligrams. It happens twice a day, it looks like, and it's right now it's in the morning, which is what her time is supposed to get. Perfect. Then her insulin, she gets the insulin. She has the 4 units because she has the blood sugar of 180, and the scale was 150 to 259, 49 for the 4 units of insulin. I will have a second nurse verify this before I administer this to the patient. Alright, and then I will document all this after I administer to the patient, and we will provide education as we go into the patient's room. Knock, knock, knock. Hi, Mary. My name is Stephanie. I'm going to be your nurse. Yeah, I know. I saw you a little earlier. Can I just see your bracelet? Perfect. What was your first and last name? Okay, perfect. And then your date of birth? Alrighty, perfect. Yeah, I'm just making sure that we're just going to match up all your medications. It's just some of our medication checks. And then, yeah, I have the antibiotics. Yeah, the doctor talked to you about your UTI. Okay, and then I have your metformin, and then I also have your insulin as well. Your insulin level wasn't too bad today. It was 180. It's better than yesterday's. So, that's good, yeah. All right, awesome. Let me go ahead and scan your bracelet. That's a good thing about technology is nowadays we can just scan everything. And it puts you right in the system. It tells me what I need to do for all my medications. It says when I administer them. And then it says if I didn't put enough in there. So definitely helps. And now it's letting me know I need a second nurse check for this one. Luckily my coworker is right here.
Oh, hi.
Hi, can you go ahead and do a second med check for me?
Oh, sure, sure. Let me see. What do I see here? Oh, look at this. 4 units. Okay, there you are.
Thank you. Can you go ahead and sign that for me?
Sure can.
Alright, so while he's signing that, I'm going to go ahead and put my gloves on. And we're going to go ahead and do that insulin shot. I know you're getting ready for breakfast. And then I'm going to go ahead and get started on all that IV fluids. Do you have anything to drink right now? Okay, can you go ahead and take a sip? That way I can make sure you can swallow your medication. Perfect. Yep, it looks good. And you're familiar with the metformin then? Alrighty, there you go. Alright, perfect. Looks good. And then I'm going to go ahead and clean your arm. So you want it under your arm? Oh, on your stomach? Okay, which side? Yeah, that side looks like it's been used a few more times. So we'll go ahead and go on this side today. So I'm going to clean your skin for 30 seconds. It just helps clean up all the bacteria, okay? Yeah, all those germs. Alrighty. So while I'm letting this dry, I'm just going to look over everything one more time. All these medications. Yes, perfect. Okay. So this is the insulin, 4 units. Go ahead and look, it's all dry already. That's awesome. Perfect. I'm going to go ahead and put the Safeguard on here and throw it in the Sharps container. Yeah, that wasn't too bad at all. Alright, and now we have we're going to go ahead and hang the IV medication. Before I do that, I'm going to assess your site. I don't see any infiltration. I know the line's patent because it's hooked up to the IV already with normal saline. I'm going to go ahead and pause the machine right now. I'm going to hang up the other fluids. Alright, now that I went ahead and back prime this, I'm going to lower the other fluid down below this one. Here, let's do that. There we go. Yep, this one is higher than this one. That is correct. And then the machine is right here. So I'm going to go ahead and program in the new medication into the machine. Alright. And re-verify the medication. It is 2 grams and 100 milliliters, and it's set for 30 minutes. So it's 200 milliliters an hour rate at 100 milliliter volume. And it'll go back to the normal saline afterwards. Those are compatible. I did clean the Y port before I administered it. I back primed it with the normal saline before doing that. All right, everything looks good. It's according to my MAR, according to the patient's reports. I'm going to go ahead and hit start and make sure it's running. Yep, it looks like it's running. I can see it dripping. So perfect. Alrighty. Alright, well let me know if you need anything else, okay? Alright, have a good night.